Welcome to Defining Dad Bod, where we work to untangle the messy knots of the health and fitness industry as if your children's lives depended on it. Because they do. This is where we decide to make our bodies stand for something bigger than ourselves. This is where we find practical wisdom to live by, one powerful conversation at a time. May the words spoken here inspire you to keep moving forward no matter where you are. Who knows who you could be if you could become 1% better every single day.
We can do the show thanks to the support of listeners just like you. For more information how you can become part of the inner circle, go to findingdadbod.com/inner circle.
What's up, guys? This is Alex Van Houten with Defining Dad Bod. I hope you're doing super well. Happy end to No Shave November. I don't know about you, but I'm ready to get this beard a little more ruly. However, every year I grow it out in honor of Prostate Cancer Awareness Month. And last year about this time, we published a show called Facing Cancer as a Fit Father. And Coach Craig Niesick came on the show, and he and I had a conversation about his diagnosis, treatment, and remission of prostate cancer. It was a great show. You can check it out, episode 58. To hear his story and how health and fitness played into the preparation and recovery of his journey as a father through prostate cancer. However, today's conversation is on the other side of the coin. Something a lot of people don't want to talk about during Prostate Cancer Awareness Month is men's sexual health. And today's guest, Dr. Judson Brandeis, is one of the world's leading experts in men's sexual health. And so I'm very excited about today's conversation. Today's intro is also a warning. I know a lot of my listeners listen to Defining Dad Bod with their kids around. Unless you want to field some awkward questions, Dad, you might want to listen to this one with headphones on. And I also know a lot of our listeners are ladies. Ladies, today's conversation is unabashedly about the guys. And so if you're a bit squeamish about male anatomy, you might sit this one out. But if you can hang with us, today the all-powerful GAIN train meets the all-important love boat. And I think it's important information for everybody to hear. If you haven't already, subscribe to our YouTube channel to get exclusive content paid for by our patrons at patreon.com. The link's in the show notes below. And while you're at it, don't forget to review the show. Your reviews are sincerely appreciated to help spread the message of Defining Dad Bod. We can't change this parenting legacy of health and fitness without you. And as an added bonus, if you'll screenshot that 5-star review and email it to me at coachal@definingdadbod.com with your mailing address, I'll send you a little thank you gift I know you'll appreciate. And now, without further ado, let's talk men's sexual health with Dr. Judson Brandeis. What's up, guys? This is Alex Van Houten with Defining Dad Bod. I hope you guys are doing super, super well. I am ridiculously stoked here in No Shave November to be hanging out with the one and only Dr. Judson Brandeis. Doctor, how are you doing today, brother?
Oh, I'm doing fantastic. It's such a pleasure to be here.
Yeah, and I appreciate you, and I appreciate what you do. I want to give a disclaimer to the listeners real quick. Quick warning, if your kids are listening or your wife's around and it might just be a little bit of a difficult conversation to you, we are talking men's sexual health today, which is a common and important topic post-prostate cancer. And so I am really excited to hang out with Dr. Brandeis and pick his brain on his expertise. So just a quick introduction to our man here, board-certified urologist with his hands in all kinds of important pots, research, development, creative, and helpful clinical practice with regard to his patients as well. You're going to hear a bunch of that today. And as I understand it, you're actually the clinical director of excellence for GAINSWave. And we're going to talk about some of the technologies to help men in their sexual health today. Doctor, why do you do what you do? And tell us a little bit about how you got here.
Sure. So I've been in clinical practice almost 20 years, and I was in clinical practice as a general urologist, so treating the kidney, the prostate, the bladder, and I was always interested in technology. I was a very early adapter of robotic technology, of using MRIs to diagnose prostate cancer. I set up a kidney stone center, and so then I discovered GAINSWave, and GAINSWave is an amazing regenerative treatment for erectile dysfunction, and I said, if this really is true, this is going to be absolutely an amazing technology for guys to regenerate their sexual function and their physical intimacy with their spouses. And so I really kind of jumped into that. And what I found was it's a field at the very beginning of learning what the clinical science is. And so I became director of clinical excellence for GAINSWave, and I really threw myself into creating clinical research. And so I have the SWEET study, which is the largest clinical research study in the history of shockwave therapy, where we're going to try to enroll 3,000 patients and really begin to define and refine what the exact protocols for improving sexual function in men is as they age.
Man, we're going to dive hard into that in just a bit. So first of all, I appreciate what you're doing, because not only as a board-certified urologist have you helped a ridiculous number of men, but I have a heart when it comes to this defining dad bod movement. We want to improve men's lives in all aspects: fatherhood, their work, their professionalism, their relationship with their spouses and whatnot. And I see it as foundational in the world of health and fitness to help people through exercise and nutrition. But one of the things that I can't touch is the medical side of things, especially with regard to men's health, especially with regard to their sexual health. So first of all, just knuckle bump across the country to you. Keep doing what you're doing, and thank you for that.
No, I mean, I love the title of your podcast, Defining Dad Bod, because that's so many of the patients that I see, and I'm really motivated to help. You know, as a father of 4, as a professional, as someone that gives a lot to his family and to his profession, I totally connect with your mission, and I really respect it. I mean, there are so many guys out there that are doing the right thing, that are working hard every day, that are giving to their family, giving to their spouse, giving to their job. And at the end of the day, they're at this big funnel and no one's giving to them. You have to learn how to give to yourself, and you have to understand that you deserve people to give to you. And it's important that you take care of yourself. And so when I got the message that I had an invitation to your podcast, I was really excited, because I think that's part of my mission, is to help guys give back to themselves. And one way to do that is through physical intimacy. That's an important part of relationships, an important part of guys' lives.
So you bring up something really important, and that is there's actually an intersection between the physical and mental health and fitness of a man and the sexual health of a man. And you were talking about physical intimacy. And I was a young trainer 12 years ago, and I remember working with a guy in his 50s. This is the first time that I'd hit this head on, because you're 19 years old and you just, you take all of this stuff for granted.
Absolutely.
Things work kind of like they're supposed to work most of the time.
Youth is wasted on the young.
Yeah. So this is not even a conversation, erectile dysfunction and all that stuff. It's, you're like, yeah, when I'm of a certain age, I might have to deal with that, but not now. So I'm working with this guy, and he comes to me with some weight loss goals. He wants to get off his blood pressure medication. He'd like to lower his dependence on statins for his cholesterol, right? And so we work together, and I create a program for him, and he does a stellar job, just an amazing job. Dude's running his business. He's coming in at 6 a.m. He works out. He's eating well. And so he comes in, I'm a 19-year-old guy. He's 54. He comes into our session. We got leg day today. And he goes, "Oh, I love leg day." And I was like, "I'm glad I've made you love leg day. I've kind of passed on some of my masochism to you, that you love walking upstairs." And he goes, No, it's not that at all. And I was like, "Oh, why do you love leg day?" And he goes, "Dude, last week after leg day, I went home and my girlfriend and I we just went at it for like an hour, and it was the best sex I've had in like 20 years. And I was, I'm 19. I'm like blushing on the fitness floor. Like, are we supposed to be talking about this? Like, I don't even know. And what was interesting is I didn't even know enough about the hormonal systems at the time to know why that was the case. Apparently, leg day boosts testosterone by a significant amount. And as you'll talk about momentarily, there's some stuff that happens kind of at the mechanistic physiological level.
Right, well, it boosts pelvic blood flow.
Exactly. And so you go home and you're, not only are you ready to go, but you were able to go. And well, he went. And so that was good. Now, personally, that was my first introduction to the idea that there was a deep connection to a man's physical well-being, like physical health, like getting off my statins, losing the weight, feeling confident, and the idea that I can go home and not just feel confident enough to perform well, but that I go home and everything's working like it's supposed to in a powerful way. And this guy continued to train with me for like a year after that, because he's like, if I stop working out, I'm going to lose kind of some of this benefit and whatnot. So that was my first experience with it. When did you start to find, because I know in your urology practice, there's an amazing amount of technical knowledge required to do what you've had to do in the last 20 years. But there's a certain point where a doctor can sit down like you with the heart for guys and say, man, you're 50 years old. You've been busting your butt. Like, you've been doing all the right things, and now it's time to do something for you. When did that connection happen for you?
There's something called the Massachusetts Male Aging Study. So it's a longitudinal study where they followed guys for like 20 years. And what they found is the rates of erectile dysfunction are surprisingly high. So what they found is for men in their 40s, 40% of men had some degree of erectile dysfunction.
Wow.
For men in their 50s, 50% of men. For men in their 60s, 60% of their men, and so on and so forth. And so it's a lot more pervasive than we think. And guys just don't want to talk about it. Guys don't like coming to the doctor as a generalization. When guys come to the doctor, they don't want to talk about it. Or when you go to your primary care doctor asks you about your heart, your lungs, your liver, your kidneys, so on and so forth. And by the time you get the courage to work up to talk about erectile dysfunction, it's time for the next patient. That's why Get Roman and HIMSS and those kind of online pharmacies have been so successful, is that it's a relatively anonymous, convenient way for guys to get that kind of advice.
Yeah, well said. So before we jump into the nitty gritty here, if you had something to say to a guy who's listening who, would prefer not to talk about it, what would you say to kind of reassure him that it's okay to care about this for himself?
Well, of course it's okay to care about it. But my philosophy and my practice is there are three things that guys really care about. Guys want to feel good, guys want to look good, and guys want to have great sex. Those are sort of the pillars, the three pillars of what we do in my office. And so it's important to check testosterone levels because that's what makes guys feel good. Physical fitness is really important in terms of feeling good, but there are other technologies and biohacks that we can talk about that will make you look good. And then it's important to have great sex. I mean, physical intimacy is a really important part of life. It makes people happy. It makes people healthy, gives people a reason to live and to thrive. And so that's a critical part of life that every guy should be trying to go after. And you deserve it.
Well said. Appreciate that, doctor. So I generally on this show deal with the feeling good and looking good. That's something that we talk a lot about. I have broached the subject of sex in men's health realms very, very sparingly, mostly because I don't know how many young kids might be listening. So I gave everybody a fair disclaimer. The doctor and I are going to be graphic, so suck it up and be a man about it. And if you're one of the ladies who listen to this show, you can pass this on to a guy you love, and you can say, I thought you might find this interesting. And that could be a powerful connection. But that being said, so I connected with, from a training perspective, I connected with the testosterone thing relatively early, right? We all know, we know enough now that resistance training, eating relatively well, sleeping well, reducing your alcohol and perhaps even your overconsumption of caffeine, all of those things can positively affect testosterone, which is great for sexual health. So my listeners have heard that from me before. It's a topic worth diving into in greater detail at some point. But with regard to what you do, there is a large body of, I don't know what to call it, emerging technologies.
Absolutely.
And emerging treatments and stuff that are helping guys to have better sex. And it's not just with regard to being healthy and fit and eating well and exercising well. There's actually something that could be said about the aging process and our machinery, so to speak. So could you give us an idea of the scope of what you're doing in your clinical practice for better sex? And then we can dive into each of those things.
Sure. Well, let me give you an overview, which is the heart pumps, right? And the heart is basically a little pump that has to pump blood 60,000 miles. So someone took actually all the little blood vessels out and stretched them out, and your heart has to pump that blood 60,000 miles.
Amazing.
And when the heart pumps, the first place the blood goes is back to the heart through the coronary arteries. And then the blood goes to the brain, and then the lungs, and then the liver, and then the kidneys, and then the intestines. And then what happens is the blood vessels split to left and right, and then the blood vessels split down the leg and to the pelvis. And then in the pelvis, the blood goes to the buttock, goes to the tailbone, it goes to the bladder, goes to the prostate, goes to the rectum, goes to the vas deferens. And the very last place in the body that the blood ends up going is the penis. So the thing that guys think about the most is the last place that blood flow goes. And the blood flow in the penis has to get up pretty high in terms of blood pressure, right? So your blood pressure in your aorta is 120/80, but the blood pressures in the penis have to get to 200 to 300 to 400.
Wow.
And the reason for that is as the blood flows into the penis, when arterial blood flows in, venous blood flows out. So that's when you get a full penis. But you don't want to have sex with a full penis, but not a rigid penis. So what has to happen is the blood pressure has to get high enough to exhibit a tourniquet effect on the venous blood to block the blood going back to the vein. And so then when that happens, you get a rigid erection and the penis rises. So the penis is the only organ in the body with skin, but no muscle. And it's the only organ in the body that moves entirely based on blood flow. And so you need to have very high blood pressures in the penis. So anything that'll compromise that. And so the arteries that go to the penis are about 1 or 2 millimeters in size. The arteries that go to the heart, the coronary arteries, are about 3 or 4 millimeters in size. So it's important to know that erectile dysfunction can be sometimes a canary in the coal mine for cardiovascular disease. So when they looked at the large prostate study where they were looking for the development of prostate cancer, one of the things that they found was that when guys presented with erectile dysfunction, within 7 years, 15% of those men had some sort of major cardiac event. So when you block 1 or 2 millimeter arteries, the 3 and 4 millimeter arteries, 5 to 6 years later, will sometimes get blocked.
Can I pause and talk on that subject for just a second? Because this is a
Absolutely.
really powerful thing that you're saying. So one of the things that I've been, I don't know, criticized might be a harsh word, but I've been criticized for in the training industry for helping people grow muscle as well as increasing their strength regimen is I have a non-negotiable cardiovascular exercise principle. You know, I always say nobody looks good in a pine box. But one of the things that I love to also make sure that people understand is the benefits to the brain of cardiovascular exercise. But what I hear you saying, doctor, and this is not something that I've articulated previously on the show, so I appreciate this. What I hear you saying is that if you're in poor cardiovascular health, regardless of anything else going for you, if you're in poor cardiovascular health, then one of the first organs that would show you the symptoms of that would be your package, man. If your penis is not doing its job, one of the things that would benefit you would be to get in better cardiovascular shape. And so as I understand it, there are a number of things you're going to talk about that support and promote the healing, the restoration, and the ability of those tissues to do their job appropriately. But to any man listening who just hates cardio, you're going to have to suck it up, Buttercup. Okay, that's Coach Al. What do you have to add to that, if anything, before we move on?
No, I couldn't agree with you more. I mean, I talk a lot about the penis and about sex and about physical intimacy, but really my focus is getting blood flow to the penis to get the penis rigid so you can have penetrative intercourse. I'm basically a blood flow to the penis doctor.
Perfect.
If you want to get really, really subspecialized. But, you know, that's important.
Yeah, no joke. Apparently, given your 3 pillars of your business, it's of primary importance, like 33% of the purpose of man here, right? But given saying that, though, that's really important. I really want to drill down on that for guys, because it's one thing to say that I want to stay off my blood pressure medications and I want to lower my cholesterol and I'd like to improve my body fat and all that stuff. And I often talk about how cardiovascular exercise keeps the heart healthy. If you're dead with a 6-pack, you're still dead. But even beyond that, to say, okay, you're in great shape, you have a low body fat percentage, everything's happy. But if your heart's nice and strong, that gives you optimal opportunity to get everything down south working like it's supposed to. And so given that, thanks for the opportunity for a soapbox, doctor, and I'll let you continue with your super specialty there.
Well, I mean, the thing is, do you want to have a 6-pack and no erection, or do you want to have a 6-pack and have an erection?
Right. Or even a 4-pack. I think a lot of guys will get away with a 4-pack and a great erection. Yeah. You know, like, I don't mean to laugh about this, but this is really important. I worked once with a 24-year-old bodybuilder, and the dude was like a mountain of a man. Okay. Like, he's 6'8". He weighs 225 pounds. He could bench your mom's Volkswagen. Like, he was a monster. Right. And so he comes in and he gets his cholesterol and his testosterone together, and his testosterone is that of a 65-year-old man. Like, you wouldn't know it by looking at him.
Right.
Like, everything that's manly in the look is right there. Right.
Right.
But his cholesterol is also significantly low. His HDL cholesterol, you'd expect it to be in the 70s or more, given his weightlifting proclivities, but it's in the 20s. And that's because he was eating such a low calorie diet with such a low fat content for so long that literally his testosterone was unable to keep up. And I asked the guy, like, what are your goals right now? What are you trying to do? And he's like, I'm doing this bodybuilding stuff. It's great, but I have no energy and I have no interest in sex. It's like, whoa. And he would tell you, I would trade all the muscles in the world for this not to be a problem in my relationships right now. And that was powerful.
Yeah, absolutely.
So that said, let's talk then. So you gave us a great anatomy lesson and how this works and how it's important. I kind of hijacked the soapbox for cardiovascular health, but let's talk about what it is that you're doing that most people probably have never heard of to help people with this pump.
Exactly. So, there are really 5 things that aren't intuitive. So the intuitive stuff is, cardiovascular exercise, don't drink, don't smoke, drink a lot of water, eat well, all that kind of stuff that everyone's been talking about for the past 20 years. But there are really 5 things that I recommend that are pretty unique. One is a nitric oxide booster. The second are PDE5 inhibitors like Viagra and Cialis, and we can talk about how they work. The third is GAINSWave Shockwave Therapy. So treating the penis with intense pulses of energy that cause the growth of new blood vessels, called GAINSWave. And then the fourth is using a vacuum erection device. And then the fifth is a P-shot or platelet-rich plasma. And we can go into all of those.
Yeah, I would love to. If you don't mind, I'd like to prioritize them though. The first one that I read about when I looked you up that caught my attention hardcore was GAINSWave. And the GAINSWave helped me understand this a little bit better. When I read shockwave therapy and penis in the same sentence, I cringed and it scared me. I was like, ah! We've all probably played around with a TENS unit or something, and the idea of that going on down there. It's not the same thing, obviously. So I'd love to hear from you. What is that? And then we'll get to the nitric oxide and then PD5 inhibitors.
Absolutely. So GAINSWave actually got me into sexual medicine too. So we're on the same page. So shock waves are intense waves of energy. So they're different than sound waves. So they discovered shockwaves actually in World War II when we were dropping depth charges on submarines. And what they found was it wasn't actually the shrapnel that caused injuries. It was this intense wave of energy from the explosion that tore up people on the inside, caused massive internal injury. And so the Germans, 20, 30 years later, figured out how to harness those shockwaves and use them to break up kidney stones. That's what we call extracorporeal shockwave lithotripsy, to break up kidney stones. But those are focused waves.
And they're not ruining everything else in progress. Yeah,
exactly. Well, because they're actually focused on, we used X-rays to focus the shock waves on specifically the kidney stone. Now, a lot of what we do with GAINSWave is to use radial waves. So you can think about someone dropping a pebble into a pond and those waves kind of rippling out. So the waves aren't as intense, and it's called low intensity shockwave therapy. But what you're trying to do is there's something about the waveform of a shockwave that when your body experiences the shockwave, it thinks it's being injured. And when your body is injured, it generates an injury response. And part of that injury response is a healing response. And part of that healing response is the growth of new blood vessels. So in scientific experiments, you can see upregulation of stem cells. Stem cells are cells that can become other cells. You also see an upregulation of what's called vascular endothelial growth factor. So it's a growth factor specifically for growing new blood vessels. And you see an upregulation of nitric oxide synthase, which is a chemical in your body that creates nitric oxide, and nitric oxide is responsible for opening up blood vessels. So GAINSWave has this effect of growing new blood vessels.
Got it. Okay, so I'm going to draw a analogy here and correct me if I'm wrong. One of the things that you said about the penis, anatomically speaking, it's the only organ in the body that does not have a muscle to move it. That's not part of a muscular system. So if I want a runner, for instance, to become more explosive in their abilities to sprint, then one of the things that I'm going to do is I'm going to focus on resistance training the calf. And one of the things that happens when you resistance train the calf, you do single leg calf raises at full extension and whatnot. One of the things that happens is it stimulates the body to create new capillary growth, and it strengthens the blood flow to the area so that the cells in the calf can continue working like they're supposed to. You get more spring in your step, so to speak, and you're able to do your thing. The problem, unfortunately, with the penis is there's no machine for that. Right. There's no muscle, therefore no stimulation of the growth of new capillaries based on, I can't assign 12 penis raises. That's not a thing. So that being said, it sounds to me like you're creating a similar positive stress on the body with a non-invasive, non-injurious apparatus. Is that correct?
Exactly. So you trick the body into thinking that it's being injured, and it generates this response. So it's similar in a lot of ways to a lot of the cosmetic dermatology procedures like microneedling beaming or RF or laser.
Yes, okay.
But there you're actually creating an injury that your body heals. It grows more collagen. Your face looks plumper. Your skin looks better. Here you're actually tricking the body into thinking that there's an injury. You generate stem cell proliferation. You release VEGF. You release nitric oxide synthase. So you grow new blood vessels.
And I imagine the guys listening appreciate that there's no injury to the area in the process.
Exactly. And, unfortunately, all these scientific experiments have to be done in rats. So, you can't really do shockwave on a guy's penis, cut off the penis and look at it under the microscope.
Right. Yeah. Well, and we all appreciate that as well. Eunuchs.
So a lot of this work has been done at UC San Francisco. So if you're in San Francisco and you see a bunch of dickless rats, you know that they participated in that study.
Just as a side note, if anybody runs across a eunuch rat.
Yeah.
So thanks for that. So I did a little bit of reading prior to our conversation here. One of the things that I saw that I thought was interesting was the removal of plaques. Am I understanding this correctly? I understand in cardiovascular disease that you can get blockages in arteries that reduce the blood flow to the heart. Is it possible to also have blockages in arteries that are reducing the blood flow to the penis? And if so, how is this removing those plaques?
Right. So there are two mechanisms. One is the growth of collateral circulation, called neovascularization. The other is using the shock waves to dislodge small amounts of calcium in the walls of the artery, called microplaques. Okay, that is a little bit more difficult to prove because young rats don't have microplaques. But it's postulated that because shockwave therapy breaks up kidney stones and breaks up calcium and dislodges calcium, that's possibly one of the ways. And a lot of men who are in their 50s, 60s, 70s, 80s will have microplaque in the microvasculature going to the penis.
Right. And it's normal for arteries to begin to calcify with age anyway.
And what you do see, and it's been proven in several studies, is you can do what's called a Doppler ultrasound. So you can use ultrasound to check the blood flow going into the penis when the penis is erect. And when you do Doppler ultrasound on people that have not had shockwave therapy but had sham therapy versus those who've had shockwave therapy or GAINSWave, you'll see an improvement in the blood flow. And so it's postulated that there are two mechanisms. One, growth of new blood vessels, and two, removal of microplaque or microcalcification.
Right. And as you said, largest studies done on this sort of thing, regardless of the mechanism, which I appreciate you explaining the possibilities here, regardless of the mechanism, we are seeing improvement in the blood flows. So unless we've not exhausted the subject, I thought it would be pertinent to, given time, continue on to nitric oxide and PD5 inhibitors. What can you tell me about those with regard to improving men's sexual health?
Absolutely. So when I was at UCLA, there was a professor, Lou Ignarro, that I had, who was a professor of physiology, and he actually won the Nobel Prize in 1998 for discovering nitric oxide as a second messenger. And so what happens in your body is your nerves release nitric oxide, and what that does is it opens up blood vessels. So in your body, you need to shunt blood from place to place. So if you're exercising, you need blood in your big muscles. Then after you exercise, you go to eat, you need your blood in your intestines. And then after that, if you're going to go study, you need your blood in your brain. And so nitric oxide works with the nerves to shunt blood from place to place. And that's true in men, in women, in dogs, cats, giraffes, rhinoceroses. Any mammal uses nitric oxide to communicate between nerves and arteries. The problem is, as you get older, you lose endogenous production of nitric oxide. So a man in his 50s on average will have lost 50% of his nitric oxide production. A man in his 70s may have lost 25, almost 80% of his endogenous nitric oxide production. Now think about it. You walk into a room with a dimmer. If the dimmer switch is down to maybe 20, 25%, you can still walk around the room, but you can't speed read and you can't do surgery. Right. So people just accept as they get older that that's part of getting older, but that's actually physiologically what it means to get older. So your blood vessels, we talked about earlier about your heart being a pump and pumping blood into blood vessels. There's no way that a pump that is small as the heart is going to be able to pump blood 60,000 miles. So what happens is your blood gets pumped into your arteries, and your arteries have muscular walls. So veins don't have muscle, but arteries have muscle. So arteries expand, creating potential energy, and then they contract and create kinetic energy. And that comes from the muscular wall. So the arteries are elastic, they expand, and then when they contract, they push the blood further. And so blood is constantly getting pushed out to the periphery. But as you lose nitric oxide, you lose the elasticity of blood vessels. So instead of an elastic vessel, you end up with a PVC pipe. And when you have a PVC pipe, what has to happen? Your heart has to pump harder. And when your heart pumps harder, what do we call that? We call that high blood pressure. So then you go to your doctor, your primary care doctor, and he says, oh, you got high blood pressure. We're going to put you on a blood pressure medication. So what does that do? It decreases your blood pressure. What does that do to your erections? It makes your erections worse because remember, the penis is at the end of the line in terms of getting blood. And so if you're decreasing blood pressure, you're decreasing your heart's ability to pump blood out to the periphery. And so then what happens? You're not getting good erections because you're on this blood pressure medication. Then you don't get nighttime erections. And then what happens? Then the penis becomes more fibrotic because it's not getting enough oxygen at night. So at night, when you're younger, you get 15 to 60 minutes of erections. It stretches the tunica, which is the inner lining of the penis, and it oxygenates the spongy tissue. And so that's the beginning of the negative cycle. And the longer you can push out that negative cycle, and the easiest way to do it is to take a supplement that's like a nitric oxide booster. Like I have a company called AFFIRM Science, and we produce a supplement called AFFIRM that's packed with nitric oxide boosting basically extracts or food. So it's
adaptogens,
watermelon, rind, it's ginseng, it's beets, it's potency wood. And all these foods basically have substances that are high in nitric oxide.
And those have been studied, by the way. It's something that I've broached just briefly on the show in a number of places, but those have been studied in a number of realms to be helpful with performance as well for the same reason, because the nitric oxide is not just a penis thing. It's an entire vascular system.
I mean, it's been shown to reduce the risk of Alzheimer's, reduce the risk of dementia. It improves athletic performance about 2 or 3%, which doesn't sound like a lot, but if you're, running a marathon, that's several minutes.
Well, when you're athletic, 2 to 3% improvement anywhere is like the reflection of 4 to 6 months of training.
Oh, yeah. There you go.
So that being
you have 4 to 6 months in a bottle.
4 to 6 months in a bottle. I'll make sure that we have the link to that below, because one of the things I like about what you're doing is you're not synthesizing a bunch of stuff. This is like, hey, this is just an ultra concentrated version of something you could eat if you had a bunch of it around. But
right, you'd have to eat a lot of watermelons.
Well, I was going to say people aren't eating watermelon rind very, but hey, so that's really important. What about the PD5 inhibitor? So we talked about nitric oxide and it affecting the global vasculature and why that's important for sexual health. What about PD5 inhibitors? This is something I'm legitimately not schooled in at all.
Right. So throughout your body, you have enzymes called phosphodiesterase enzymes. And what they do is they break down what's called cyclic GMP. So it's the byproduct of the nitric oxide metabolism that stimulates blood vessels to open up. Okay. But you can't leave blood vessels open forever. You want to close them. And so you use these phosphodiesterase enzymes to break down cyclic GMP into an inert form, which makes the blood vessels get smaller. And there are PDE enzymes everywhere throughout your body. But the genius of Viagra or sildenafil was that someone figured out that the PDE5 lives in the penis. And so if you block PDE5, then you specifically dilate the arteries in the penis. So they were doing a study on sildenafil or Viagra for cardiovascular disease, and they had 100 patients who were on the medication and 100 patients who were on placebo. And at the end of the study, they said, okay, it's time for you to turn your medications in. And none of the patients that were on sildenafil turned their medications in. They said, oh, how come? So, well, we're having the best sex we've ever had in our life. And so then Pfizer realized that they were onto something.
That's great.
And so, the great thing is that the PDE5 inhibitors work well with a nitric oxide booster. They work together. So if you don't have enough nitric oxide, then taking a PDE5 inhibitor isn't going to be nearly as effective. And if you're taking a nitric oxide booster, it's going to make a PDE5 much more effective. They're synergistic.
I love that. And I appreciate that. Thank you. So PRP, platelet-rich plasma, that's something I've heard of in a few different medical realms, but I've never heard it in relationship to men's sexual health. So can you explain that a little deeper?
Right. So I want to explain a little bit of the physiology of platelets.
Yeah. Okay.
So, you're in the gym, you're working out, and you drop a weight on your toe and you start to bleed.
Yep.
Okay. What happens? Okay. The first thing that happens is you get hemostasis, right? You form a clot. The second thing that happens is you get white blood cells that come in and gobble up bacteria so you don't get an infection, and they remove some of the devitalized tissue. That's called inflammation. Okay. The third thing that happens is proliferation, which is the growth of new cells to heal the tissue. And then the fourth thing that happens is remodeling, meaning that the scar and everything goes away. All this is mediated through platelets. So when there's an injury, you get what are called inflammatory cytokines. So the area of the body that gets injured sends out these messages that says, I've been injured. Like if in the old days when someone robbed a bank, they pulled a little lever for the alarm and the police know where to go because they heard the alarm.
Right.
Okay. The platelets know where to go because these inflammatory cytokines says there's been an injury here, go here. So then the platelets go there, and the platelets are round, right? You ever wonder why platelets can form a clot? You know, they're round. It's like stacking a bunch of marbles on top of each other. But in an injury, a lot of calcium is released, and calcium causes activation of platelets. And so when platelets are activated, they put their arms out and grab onto each other, almost like starfish. And so if you ever see a picture of an activated platelet, it looks like a starfish, you know, or a dandelion or something that puts their arms out. And when the platelet opens up like that and gets activated, it releases these things called alpha granules. And alpha granules have growth factors. So 140 growth factors have been identified in platelets, including vascular growth factor, platelet growth factor, keratin growth factor, epidermal or skin growth factor. And so that's how PRP works. PRP stands for platelet-rich plasma. So what we do is we draw blood on patients, and then we spin the blood in a centrifuge for 10 minutes. At the end of 10 minutes, what happens is the red blood cells are packed with iron, right? Hemoglobin has iron. Iron binds oxygen. So that goes to the bottom. The plasma, which is basically just the water that your blood cells float in, goes to the top. And in the middle, you'll have platelets and white blood cells. And so you'll draw off maybe half of the platelet poor plasma and then resuspend the platelets in the rest of the plasma. And then you can inject it. And so you can inject it in the hair, helps cause hair growth. And they use it in orthopedics all the time now to help like partial tears of shoulder joints, knee joints, hip joints, back joints.
That's been my experience was with those sorts of injuries and whatnot with that rehabilitation.
It's been used, it's called the vampire facelift, which is microneedling and PRP. And then you can inject it into the penis. Okay. There's not a ton of data. In fact, there's very little data on PRP in the penis. I'm actually trying to change that. So I've engaged in a study with Dr. Charles Runnels, who's the physician who trademarked the P-shot, the O-shot, and the vampire facelift. And we're doing a study on penile elongation. So our postulate is that using PRP once a month for 6 months and a variety of stretching devices and AFFIRM as a circulation booster, that we can increase penile size for men about 1 inch penile length. And so that's the power of platelet-rich plasma, is it's packed with growth factors, and growth factors initiate processes that grow new blood vessels and grow new tissue.
Wow. So given my background with exercise and whatnot, when I hear PRP, I think shoulder injury and these number of exercises and stuff, but it's wild to think that there's possibility for using that. I hope your study goes well. How many people do we have in that right now?
You know, we just got IRB approval last week.
Oh, okay.
We already have 3 people. You know, I mean, having a longer penis is something most guys are interested in. So I don't think we're going to have too much problem.
Yeah. What's your address? Just in case. I'm just kidding. Go
to BrandeisMD.com.
There you go. I'm not kidding. Like if you didn't hear anything else today, some guys are like, and where do I find this guy again?
Well, you know, the amazing thing is that it's something that guys really care about, obviously, you know, but when they do studies, 55% of men say that they would be interested in having a longer penis. The problem is that there's really not that much out there for penile elongation. So there's girth enhancement procedures like Pneuma is a new FDA cleared silicone implant for the penis. Specifically for girth. People inject fillers, but there's nothing for elongation. I've seen, you know, horrible surgeries that some people do in the name of penile elongation, like cutting the suspensory ligament and so on and so forth, and people injecting things into their penis. And, you know, it's really sad. And what this will be a very safe, scientifically proven way in which you can improve the length of the penis. And so I hope that I put all those people out of business that are doing inappropriate operations and give hope to guys that are out there injecting things into their penis that they shouldn't be injecting.
I hope so too, man. We have similar vendettas, just in completely different industries.
Yeah, but a lot of it's just based on the lowly platelet, which is just packed with growth factors.
So the last thing you mentioned was basically a mechanistic structure for stretching, if I'm not terribly mistaken. You talked about vacuum erection. Can you talk about that a little bit?
Yeah. Well, do you recommend when you're training someone that they stretch before they train, or do they just jump right in there?
As long as they're not hypermobile. And, in this situation, I've never heard anybody say, my penis is hyper long. So that's good.
Yeah.
So yeah, exactly right. So I ask people, and one of our goals usually in the foundational phases of training is to improve flexibility so that we can accomplish a full range of motion in exercises. And as I understand it, that's what you're encouraging as well.
Exactly. Well, the thing is, when you're younger, you get 15 to 60 minutes of erections every night. So you get 3 to 6 erections. They last about 5 or 10 minutes. And so you get oxygenated blood in the penis and you stretch the tunica. So the tunica is a really interesting lining substance. It's made of collagen, and the collagen goes in 2 different directions. It goes longitudinally, that's for length, and it goes circularly for girth. So it's got 2 different layers, and it's made to withstand blood pressures in the hundreds, 3, 4, 500. And so it's twice as thick as the aorta. So the biggest blood vessel in your body, it's twice as thick as that because it has to withstand not just high blood pressures, but it gets knocked around a little bit, right? Mm-hmm. And so if it's weak and you get a penile fracture, and you're a caveman, you're not going to procreate. So only the guys with strong tunicas actually were able to procreate. When you're young, everything's working great. But as you get older and you're not getting nighttime erections, what happens is that really thick, strong tissue begins to contract. And so it's more and more difficult to stretch that tissue out to get a full erection. Most guys, when they're in their 60s, 70s, and 80s, will complain that they've lost an inch of their erection. And that's just because they're not able to stretch that tissue out as much as they used to. In addition,
it's like having tight hamstrings is what you're saying.
Exactly. You used to be able to touch your toes. Now you can only touch your knees. You used to hang down to your knees. Now you're only hanging at the mid-thigh. The other part of it is the spongy tissue on the inside of the penis. Sponges work because there's space, but when that tissue gets fibrotic, there's no space. So remember I said you have to achieve a blood pressure that causes the blockage or the tourniquet effect on the veins. So, say it's 100, well, now it's 125 or 150. And so if you weren't even able to achieve a blood pressure of 100 in your penis, you're certainly not going to achieve 150. And so it's sort of a self-perpetuating cycle.
So we've covered 5 very important and just completely different from what most people would think of if we were having a conversation of men's sexual health. I know that at least my mind would not have jumped to any of those, and I consider myself pretty well read on this sort of thing.
Yeah, my mind goes to really strange places.
Yeah, apparently. Well, and it's helping people who, are appreciative of it, because this is not exactly dinner time conversation, like, hey, did you stretch your penis today? No, I probably should go get that done. Like, no, nobody says that, and so.
But the really interesting thing, I'm sorry to cut you off, but
no, that's fine.
Like you'll hear people at work go, oh, I'm taking my dad to the cardiologist today. And everyone's like, oh, that's so nice. You're so cool taking your dad to the cardiologist. But the cardiologists do the same thing that I do. They're just worried about blood flow to the heart. And it goes through 3 to 4 millimeter blood vessels called the coronary arteries. I go to work every day worrying about blood flow through 1 or 2 millimeter arteries called the internal pudendal and the cavernosal artery. And that blood flow goes to the penis. When someone goes, oh, I'm taking my dad to the urologist, he's not getting good erections, they look at you funny. They're like, what's going on with you? But it's physiologically and medically, there's really no difference between taking your dad to the cardiologist and taking your dad to the urologist to get that blood vessel opened up.
Well, and I'm thinking of this as an awesome cross-section of quality and quantity of life. Like we joked earlier, nobody looks good in a pine box. But then if you asked a guy, would you rather live 20 more years, or would you rather have great sex for the next 10 and then die? I think most people, I think most guys would be like, if my kids are in college and I've got nothing.
Exactly. Count me out.
Yeah, right. Like, yeah, I'd prefer the latter. So that being said, I could talk to you about this for a while, which is actually really surprising. If you would have told me 10 years ago that I'd be on my podcast with the word penis used like 50 times, I probably would have been like, that's weird. I don't even know how that came about. But this has been really powerful. So I want to recap for everybody and tell me if you would add anything here, and I'll give you an opportunity for the last word as we wrap up. So first of all, we talked about how physical health, especially in the form of cardiovascular health, significantly impacts both the form and function of penile tissue, which is going to be extremely important for you guys who are living a good quantity of life, but want to live a high quality of life. And you threw out some statistics earlier that were just amazing in the sense that there are many guys who would say, it's not like it's supposed to be, and that's a problem for me. And then you talked about 5 very important and very, in my opinion, groundbreaking methodologies for improving these things. GAINSWave, and I'm going to put the links to this stuff below for people to read up on and get connected with your work. GAINSWave, nitric oxide supplementation. You have AFFIRM, which is an important supplement that puts those things together. Then the PD5 inhibition, which is an important part of that whole thing. The actual mechanical stretching, which would be what do you call that? Vacuum
erection device.
Thank you. Vacuum erection device. The VED. I'm just kidding. I just made that up. All right. And then PRP therapy, which is in process for clinical trials. If you want to go sign up, find Dr. Brandeis's information below. What would you say if listeners weren't going to take anything else away from you today? What would you say to leave them with the last word here in No Shave November 2019 on Defining Dad Bod?
You should be empowered to take care of yourself. You're a good guy. You take care of your kids. You take care of your wife. You take care of your job. It's okay to take care of yourself. It's okay to do things for yourself to improve your physical health, to improve how you feel, to improve your appearance, and to improve your ability to have physical intimacy. And it's important to maintain physical intimacy. And there's some very easy things to do to maintain physical intimacy so that you can continue going till your 70s, 80s. I even had this one of my favorite patients. All right. 91 years old. He comes in because he is having some trouble urinating. And at the end of the visit, he leans over to me and he goes, I got something really embarrassing to ask you. I said, at 91, what's embarrassing to ask?
I know, right?
He goes, can I get some Viagra samples? I said, man, if I'm 91 and I'm asking for Viagra samples, I'm going to put that up on the billboard on 680.
Right.
But it's possible to have a healthy sex life into your 80s and even into your 90s. And it's an important part of the enjoyment of life. And it's an important part of connection with your partner. And it's a part of your life that you should be entitled and you should work towards keeping it healthy.
Doctor, I appreciate your expertise. I appreciate your knowledge and your ability to bring a potentially difficult subject for guys to talk about to the forefront. I hope it's been a good one for you and to the listeners. Thank you guys so much for listening and for cutting out your kids for this one. This has been Alex Van Houten with Defining Dad Bod. Until next time, guys, kick butt, take names. The free practical advice and conversations here remain unbought and unbiased thanks to the support of listeners just like you. For more information on how you can become a part of the inner circle of Defining Dad Bod, go to definingdadbod.com/inner circle.